Welcome to Millennium Physician Group Radio. I'm Michelle McCormick. Today, our conversation is about making lifestyle changes through the science of culinary medicine. We're also going to learn what that is. We're going to talk with two experts about how food has a direct impact on health and well-being and how to make sustainable changes. But first, Millennium Physician Group is one of the largest physician groups in Florida with over 150 offices in the state. We have over 50 primary care providers in 5 Northeast Florida counties. Millennium definitely has an office for you. Check it out at millenniumphysician.com to find the nearest location. We also just opened our first walk-in medical center in Jacksonville. This center offers extended hours during the week and on Saturdays to help with all of your primary care and acute care needs. Millennium Physician Group is your connection to a healthier life. Join us right now for a healthcare journey as we work together to achieve the best health outcome for you. All right, so according to the Center for Disease Control and Prevention, the CDC, poor nutrition is one of 4 main risk factors for preventing chronic diseases. Good nutrition is essential for staying healthy during your lifespan. But obesity, heart disease, stroke, diabetes, cancer, and so many more ailments can all be attributed to poor nutrition. Our guests today are experts in the nutrition field. They founded a company called Bloom Culinary Medicine. We're going to learn about making better choices when it comes to our nutrition. And honestly, I couldn't be more excited about this topic. I am a nutrition fanatic, and I can't wait to learn more. So first, let's meet our guests. Our first guest today is Heather Borders. Heather is a registered dietitian and licensed dietitian nutritionist focused on leveraging culinary nutrition to help individuals prevent and reverse chronic diseases. Our second expert today, joining Heather, is Dr. Lisette Bickford. Lisette is a PhD in bioengineering from Rice University and has over 12 years of experience as a cancer researcher. So I cannot wait to learn more from both of you. So welcome to the show, Heather and Lisette.
Thank you.
Thank you, Michelle.
All right, Heather, let's start with you. I want to remind listeners who have been devoted to our program since January that Heather joined us early on in January to talk about making New Year's, not resolutions, but really helping with our nutrition moving forward as we come out of the holidays. So Heather, welcome back to the show.
Oh my gosh, thank you so much. I had so much fun the first time. I had to come back.
Well, I love that. I do love that. So Heather, give our listeners a little bit of more background about yourself.
Sure. So I like to say that I'm a recovering engineer. I did have a stint in engineering, which is actually how I met Dr. Lisette. We both were at Rice at the same time. When she was getting her PhD, I was getting my master's in biomedical engineering, and she was actually my TA for one of my classes. But I feel like engineering was kind of a while ago for me. So fast forward quite a bit, and I personally had an issue with cholesterol, and as did my husband, especially my husband. So I found my way through nutrition trying to reverse cholesterol without having to take medication. And, it's kind of a long, windy story, but it was very meaningful to us that we were able to completely and totally reverse it using diet. And I was able to learn how to cook very well. And I started teaching people how to cook. And so in doing that, I was able to help people lower their cholesterol, lose weight, drop blood pressure. And I couldn't do anything to help them because I wasn't a healthcare provider. So I decided to go back to school and become a dietitian. And so that's kind of how I ended up in nutrition, how I ended up becoming a dietitian. And going on 5 or 6 years now. So it's pretty wild.
Yeah, that's exciting. And I'm going to guess your cholesterol went down. Plummeted. And my husband's cholesterol dropped like 80 points in 6 weeks. His triglycerides dropped like 200 points in 6 weeks. And mine wasn't as high as his, but mine still dropped about 50 points. So it's definitely a testimony to the fact that food matters. And then, we really were dedicated to trying to make this in something that we would enjoy. Everyone thinks that if you have to eat differently, that you're going to kind of settle and just kind of truck through it. But, I think the important part and what Dr. Lisette and I are trying to do here is show people that you don't have to become a chef and you don't have to settle through what you're eating. Like, we love to eat, we love food, and we love flavoring it such that it tastes great. Well, I look forward to learning that because I love to eat, but cooking not so much. So welcome, Dr. Lisette Bickford. You are actually on the west coast of the country. So thank you for taking time out of your morning to join us today. Why don't you give us a little bit of background about yourself?
Sure. And again, thank you so much for having me be on here. I usually wake up early anyway, thankfully, so no problem with the time change. So yeah, just like Heather, my background is also engineering. I've worked some, engineering jobs like at Ford Motor Company and Procter & Gamble. I decided to get a PhD. I was really interested in doing cancer research and learned about someone at Rice University who was doing a lot of cancer research in the engineering field. So we're talking more like diagnostics, creating diagnostic tools, like nanotechnology, using medical devices. So still very engineering related. As Heather mentioned, I was her TA, and that's how we met. And so we, became fast friends, so to speak. And actually, at the time, I was probably not eating all too healthy, and I continued like that for quite a while. After I was at Rice, I moved on to UNC Chapel Hill, where I did a postdoc there. So I had worked at MD Anderson before, and I had worked at Lineberger Comprehensive Cancer Center in North Carolina as a postdoc. And then I got a faculty position, tenure track faculty position at Virginia Tech. And it was a very stressful job. I had a very bad lifestyle. I'd drink lots of coffee in the morning and daytime and, wine at night and just, eating really unhealthy. But I just, my focus was cancer treatment and looking at medical devices. And I had a student at the time, my grad student, who said, wouldn't it be cool if we could come up with a technology that gets the immune system to attack cancer cells? So just something that you could do that could inherently attack the cancer cells. And I just thought it was just a really interesting question that he asked, because I thought, the immune system is so important, obviously, and how we treat our bodies really relates to how well the immune system is functioning. And a lot of cancer treatments, chemotherapy specifically, can be very damaging to the immune system. And roughly at the same time, Heather had invited me to this conference, the International Plant-Based Nutrition Conference. And she said, you really got to check out this conference. There's a lot of important speakers that are going to be there. They talk a lot about nutrition and how diet impacts your health. And so I was able to arrange a trip to make it over there. And so we met up in California, and I listened. It was 3 days. 3 days of whole food, plant-based eating, which was a big shock to me. I was totally not used to eating this way. And all these lectures about, how important nutrition is to your health and everything. And there was supposed to be a speaker about cancer, but unfortunately he wasn't able to make it. But there were other people who basically filled in those gaps. And so during those 3 days, I actually felt amazing. Like I had, a lot of stress and eczema issues and whatnot. And for those 3 days, like I felt, I was not used to eating I was not used to eating blueberry spinach smoothies for breakfast. But, after 3 days, I was like, wow, this is really amazing. But I honestly had, didn't really know where to start to eating like that. And I went back to my normal lifestyle, honestly, after that. I came back to Virginia and just, continued with how I was doing. But it basically planted a seed for me. And after that, due to all the stress and everything going on, I ended up deciding to leave my faculty position, and our family, we ended up moving to the Portland, Oregon area. And so here it's actually really, pretty straightforward or simple, I guess, to be vegan at least.
Right. That's what I was thinking. I mean, coast to coast, you're in that hotbed of outdoor healthy food environment, I would think.
Exactly. There's a lot, like the farmers market here is pretty astounding. There's a lot of agriculture and CSA, so you can, get food from local farms and things. And so I just, everything put collectively together, being here, I decided for a life change. I thought, I'm just going to try and do this. I was going to try and do it just for 2 weeks, basically try to be vegan for 2 weeks or eat plant-based for 2 weeks. And I was overwhelmed, honestly. I was thinking, I already cook a lot. So I was already into cooking and, eating well, just like we talked about. But I was not used to eating this drastically different way, where I was going to cut out all dairy and all meat and eggs and everything. And I was thinking I'm not going to be able, honestly, after one day I was struggling. So I thought I just need to read some literature so that I can get, psychologically behind it. And so I decided to just started reading books, and, I started reading things out loud, and my kids were listening, and then they were on board. They were like, well, I want to do this too. And so then I was really panicked, like, oh no, I got to feed them this way too.
Right. You have others that you're responsible for all of a sudden changing their dietary habits.
Exactly. Which is, it's stressful, and so I was able to navigate that. I had Heather, of course, as a resource, and, I had, it just required changing the mindset really. And rather than panicking that, oh, I have to have meat for every meal, the mindset was just shifted. So as long as I'm eating a lot of, healthy whole foods, that I knew that we were going to be okay. And so now it's been almost 5 years coming up on this fall. So it's pretty crazy.
So we're talking. Yeah, go ahead, Heather.
Michelle, I just wanted to point out that when Lisette and I met in 2014, that probably was the first time we'd seen each other since '07. And we haven't actually seen each other in person since.
Until today?
Oh, no, we've been doing Zoom calls, but we haven't met in person since 2014.
Oh, my goodness. You guys need to plan a trip. Yes.
No joke.
Well, we are talking with Heather and Dr. Lisette from Bloom Culinary Medicine. And we are, what are you guys doing with this company, and how did it come to being? I mean, you talk about your journeys and how you guys reconnected and when, 5 years ago, you changed your entire food family lifestyle, Doctor. And Heather, I know you've been on the journey for a long time. How did you guys decide this is something we need to do together, and how do we make it something for everyone?
Yeah, so we both kind of came together with different experiences. I'll let Dr. Lisette talk about her situation, but for me, I actually was diagnosed with thyroid cancer about 2 years ago, almost 2 years ago. And in doing so, I had to follow a diet called the low iodine diet, which being a dietitian, first of all, I'd never heard of it, but being a dietitian and learning what it was, I was like, okay, I can do this. This is no big deal. But I found that in the Facebook groups and just listening to what they were saying, I found that people were really struggling. And the nurse that had quote unquote counseled me on what to do, you could tell like there was only so much time she had. I was given like this stack of recipes and a handout. And, it was just not something that was very, there wasn't enough time or counseling or coaching dedicated to providing the guidance needed for this diet. And I've known others who have had, whether it's a cancer diagnosis or any other kind of diagnosis, much less being a dietitian myself and having to counsel people on diets. I know that people are not given the correct coaching, counseling, and guidance on following medically mandated diets. So that combined with Lisette's friend situation, we both came together and was like, we need to be able to give people the blueprint for what to do when they are medically mandated. So this isn't like, diabetes or heart disease, everybody should eat a heart healthy diet and like I'm team vegan or I'm team keto. This is like, there's no avenue, there's no fork in the road. You got to do this and only this. So that's kind of my end of the story. So I'll let Dr. Lisette tell her story.
Sure. So as Heather was saying, it's interesting how the timing worked out for this. Actually, I have a friend who was diagnosed with esophageal cancer. And this roughly happened around the time of, I was actually still working at this cancer center, this pediatric cancer center that's nearby, which I since have left. But towards the end of when I was there, my friend's wife contacted me and in tears. And she said that her husband was diagnosed with stage 4 esophageal cancer. And, we started communicating on a regular basis. And she said that he had to get a stent put into his esophagus. And so once that was done, he had to have a very restricted diet. And they were overwhelmed with all the things that he could and couldn't eat. They were basically just given like like Heather said, some handouts. And here's some things you can't eat. They didn't provide like recipes or, I think it's kind of one of those things where you get this list of here's what you can eat, here's what you can't, but then you have this self-doubt You don't want to give someone the wrong food because you're afraid that, especially with, something like a stent in your esophagus, you're afraid you're going to, end up putting them into the emergency room or something. And so they were just really lost. And of course, it's a big deal because you want this patient to have the right nutrition. You want them to, you don't want them getting weaker. You want them to be strong. Again, you want to focus on trying to get their immune system strong. And, it was just a very unfortunate situation. So I just felt really bad for them. And I tried really, Heather and I were talking, we were trying to figure out how to help them. And unfortunately I didn't have the time or the resources to be able to put something together for them or to be able to make a difference really for them. But it got us thinking, collectively about, there's so many situations like this where these patients have to go through these, diets. Another example is probably someone who has colon cancer, they have to get a colostrum bag or something. They have special diets that they have to go through. It's very stressful and overwhelming on top of their diagnosis, so it's just so much for them. And so we just really want to help them out. So help provide something for these, patients. A lot of our resources will be, free, and we're starting with thyroid, but our goal is to address lots of these conditions and situations.
I think it's fantastic what you guys are doing, and we're going to learn so much more about it in our upcoming segments. But coming up next, we are going to continue the conversation with Heather and Dr. Lisette from Bloom Culinary Medicine. So stick around. We're going to dive a little bit into what Heather was just talking about, and it's called the Bloom Culinary Medicine Low Iodine Diet, and we're going to find out so much more about that coming up in just a little bit. The conversation will continue. Millennium Physician Group Radio will return right after this. Welcome back to Millennium Physician Group Radio. I'm Michelle McCormick. Thank you for tuning in today. We are learning so much about culinary medicine. Who is it for? What is it? And why it is something that you need to know about, especially if you have poor nutrition, if you're dealing with any health-related issues. Nutrition is always a key factor. So let's continue the conversation with Heather Borders and Dr. Lisette Bickford from Bloom Culinary Medicine. So ladies, welcome back. And Heather, you touched on something in the first segment that I think we really need to dive into a little bit more, and that is the low iodine diet. Now, who is this diet specifically for? Is it for someone with thyroid cancer? Is it for someone who's dealing with other health issues? Let's hear more about this low iodine diet.
So for our purposes, we're focused on people who have been diagnosed with thyroid cancer, and then they have to go through something called radioactive iodine treatment. So not everybody who is diagnosed with thyroid cancer will have to go through this treatment. We estimate about 15 to 20% of the people who are diagnosed with thyroid cancer will have to go through this. So it's not everybody. There may be other reasons outside of thyroid cancer where people are following a low iodine diet, but that's not our forte. That's not what we're focusing on. Okay. So this is our home right here, is thyroid cancer, radioactive iodine treatment. So just a little background, radioactive iodine treatment was one of the first targeted treatments for cancer, because you basically swallow a pill that is radioactive iodine, like isotope. And so the thyroid is a hotbed for iodine. So when we consume food with iodine, it goes to the thyroid, and then the thyroid does its magic using iodine. And so when you take this pill, which is radioactive, because it has iodine, it goes straight to the thyroid, and it assumes that you've already had a thyroidectomy. So you've removed your thyroid. And the intention is to basically, when you take the pill, to completely wipe out any leftover thyroid tissue that has been left after surgery. Because the idea is, if you've had cancer, you want to wipe out all your thyroid tissue. So obviously there might be some microscopic tissue that's left over after surgery. And that's what the pill is supposed to do, is to wipe out what's left after surgery. So the low iodine diet, what happens is you can kind of think of like the thyroid as a sponge for iodine. And when you're normal, you have a thyroid and you're eating, it's just loaded with iodine. And what you want to do is wring out the thyroid of iodine. Okay. So that when you take the pill, it absorbs the iodine that comes with the pill. Okay. And that's going to make it very, very effective. Okay. You can imagine if you have a sponge and it's full of water and you pour more water on it, it's not going to absorb as much. So in this case, even though there's no thyroid there still might be some thyroid tissue there and it still acts the same. So you want to deprive it of iodine as much as possible so that when you do take the pill, it absorbs the iodine and it becomes effective. So this low iodine diet is followed typically for about 2 weeks right before you take the pill. And that's really what this is. So I think Lisette mentioned this. I know that I experienced this and I know it's just across the board. Whenever a healthcare professional tells you that you have to eat a certain way, usually almost exclusively, they tell you what not to eat. But they never tell you what to eat.
Right.
And they certainly do not tell you how to prepare all this food. So that's where at least Dr. Lisette and I come in. And we created the Ultimate Low Iodine Diet Survival Guide. It's a 30-page guide that is completely free, found on our website, bloomculinary.com. So we encourage people who either are going through this or know someone who's going through this to go to bloomculinary.com and download the Low Iodine Diet Survival Guide.
Well, I think it sounds amazing for folks because I agree with you, Heather. I think you're told more what you can't do than what you can do. And this resource really does sound amazing. So bloomculinary.com. We are going to continue the conversation with Heather and Dr. Lisette from Bloom Culinary Medicine. We're going to learn more about this new kind of approach to food and health. So stick around. The conversation will continue. Millennium Physician Group Radio will return right after this. Welcome back to Millennium Physician Group Radio. I'm Michelle McCormick. Today our conversation is about making healthy lifestyle changes through the science of culinary medicine. We're talking with two experts about how food has a direct impact on our health and well-being and how to make these changes sustainable. Our guests today are experts in the nutrition field. They founded a company called Bloom Culinary Medicine. We're learning so much about it and learning about nutrition when it comes to our well-being and health. First, Heather Borders, a registered dietitian and licensed dietitian nutritionist, is focused on leveraging culinary nutrition to help individuals prevent and reverse chronic diseases. And also Dr. Lisette Bickford. Lisette is a doctor from Rice University, very experienced in cancer research. And Heather, real quick, in our last segment, we were talking about the low iodine diet, about the free guide, and then we had to take a break. So let's quickly pick that back up so we can, wrap up the guide because it's free. It's on your website.
Yes. And, it's 30 pages of just so much information that anybody who's going through this should find very helpful. So just a kind of high level overview, it includes, the kind of just the facts type information. What do you need to know? How does radioactive iodine work? In addition to what not to eat, it actually includes an entire page of foods that you can eat and that are encouraged throughout this process. One of the big misconceptions that people have with a low iodine diet is two things. One, that it's a no iodine diet, which it's not. And that it means it's a no salt diet, which it's not. And so we go into the details of what salt is, what sodium is, what iodine is. And, you cannot have iodized salt, but there's a lot of salt out there that is not iodized. And we even we provide examples of some salts that are non-iodized, as well as a local Jacksonville company, Fresh Jacks. They have local handmade seasonings and spice mixtures that don't have iodine in them. And so we provide a link for people to be able to buy these components. And last but not least, it provides all the guidance on how to put together a meal using the foods that you eat that are on the list to include. And then it also includes recipes, it includes dressings, as well as things like cashew cream, because dairy is something that you can't have on this diet. So it provides really easy ways to make dairy substitutes. So like cashew cream, things like date paste, which is a way to add a sweetener. We have like a quinoa salad with lime and apples, broccoli cheddar, which is not real cheddar. It's a dairy-free version, as well as information for other resources. The American Thyroid Association, Lida Life Foundation, THICA. There's even a nonprofit called Bite Me Cancer. So a lot of resources here for someone who's going through something like this.
Well, Heather, you brought up some really great points, but how does somebody who is about to go through this radioactive iodine treatment with this pill know to start this diet beforehand?
Usually the doctor, you'll have to see a radiation oncologist, and it's usually going to start with them. That being said, I feel like I was counseled by my ENT, my otolaryngologist nurse. And again, it was like literally a 5-minute conversation. Mm-hmm. And I probably made it longer just because I am a dietitian and I was asking so many questions. But it was very much a ad hoc, casual, like, oh, by the way. Mm-hmm. And when I took the time to go into the Facebook groups, when I went in to look at the Facebook groups, it was super obvious that everyone had so many questions about how to do this, what they could and couldn't eat. And from the standpoint of Dr. Lisette and I, it was a gold mine because we created blogs based on all their questions and answered them. And we created this guide based on all their questions. So, yeah.
That's what I was going to say. The education is huge. And I think anybody, because I have never experienced it, but you just need information and you just kind of crave it when you're in that situation. I mean, I'm not speaking for all, but I would be speaking for myself. If it was something that I was going through, I would want to know everything I could about how to treat myself well during that very difficult time. So bloomculinary.com, and you have a nice little acronym I noticed on the website.
Yes. So are you speaking about the course Eat for RAI?
Yes.
Yes. So, yep, the end game is to have a course, and it'll be called Eat for the number 4 RAI, meaning radioactive iodine. And the intermediate step is we're actually going to have a free webinar, and the free webinar will kind of go over the basics of what is entailed with the low iodine diet. And it'll give people a little taste of what the course is going to look like. There should be some cooking demos, a meal plan guide, and all the steps necessary to help people through.
Well, thank you for that. I find it very informational. Heather and Dr. Lisette from Bloom Culinary Medicine. So what else are you guys doing through this unique approach to health and well-being through nutrition?
Lisette, you want to talk about the e-magazine?
Yeah, so something that we're offering on our website, and this is not specific for radioactive iodine or the low iodine diet, is that we're offering a free quarterly e-magazine. And so this is something that we offer seasonally. And so what basically we offer 10 to 11 recipes using seasonal produce. We have some information on there about the different benefits based on actual peer-reviewed studies, benefits on these actual produce items. And we usually have a guest writer. We did the first couple of articles, I think, but we have a guest writer who talks about wellness, another health professional who talks about wellness. It could be like mental health wellness or reducing information like that. We also have kitchen resources and culinary tips and tricks that we recommend. And then we have a research article that we provide, again, based on peer-reviewed research that just talks about different aspects of plant-based ingredients and how they benefit the body. So it could be like, it could be an article about healthy fats, which may not be what people think. There's so much discord, I think, on fats.
Yeah. Name a few that are healthy for us, doctor.
Walnuts. Everybody talks about the omega-3 fatty acids, right? So, and people normally think of fish, but, in our articles that we're providing on there, for instance, we talk about actually the plant-based sources of omega-3 fatty acids and go into a little bit more detail about that. So that people aren't thinking that, there's also a lot of information out there about how fish these days can be associated with a lot of toxic things in the ocean and stuff, unfortunately, because the ocean is not very clean. So we just kind of go into that, information where people may be confused about, plants and fats. We kind of try and clear that up. So every quarter we provide this information to people sign up on our website at bloomculinary.com, where people can subscribe, and they just get this free quarterly e-magazine. So yeah, and it's got like all these resources and information. So
it sounds great, because I think when people hear plant-based or they hear vegan, it's like a thing might just shut down. Like, oh, that's just hard. It's so hard to like change. And you're a great example of doing that 5 years ago with your family. What did you find, doctor, to be the most difficult part of making that lifestyle change?
I think most people would probably say it's difficult to get their families on board, actually. And I would say, for me, that was not so much the challenge. My kids were actually really on board. I just was fortunate, I guess, that my older child was, eavesdropping on on videos that I was watching or whatever, and then, I even mentioned some like artificial food coloring and candy that was associated with some bad, I guess, mental effects or whatever. And she immediately ran downstairs to go look at the candy that she had and was suddenly throwing it all in the trash and said she recognized the the food coloring that I mentioned. And so most people probably have that challenge on board, because, you probably feel like you have to cook something for yourself, and then maybe you have to cook something differently for your family. And that's, even more overwhelming. A lot of kids today, for instance, want to eat, chicken nuggets and mac and cheese. And so the key is probably trying to come up with a list of foods that everybody likes as their standard things, and then trying to make incremental changes on how to improve those, how to make healthier substitutes. Like there's actually a really great plant-based mac and cheese recipe that we have not posted, but it is actually pretty amazing. My husband is, I would say, a mac and cheese snob, and so he was blown away by this.
I've been really surprised at how much I like cauliflower rice, cauliflower crust. I'm surprised I like cauliflower at all. But I have to say, after I eat my cauliflower wings or whatever it may be, I do feel better. Why do you? I know it's not the processed foods, and we could really go down a rabbit hole, but it's just, how long does it take your body to reset?
I would say that is an it depends question. And I think it depends a lot on what's going on with that person at that time and where they're coming from. So, I've seen people who were, miserable, and they, by definition, if you look at what they were eating, it wasn't that. You wouldn't expect that they would feel that bad based on what they're eating. And then you'll see people who don't seem to be struggling that much, but when you look at their food log, it's just as incredible. It's like, what are you doing to yourself? Like, you're not eating anything nutritious whatsoever. So I would say, if you wanted to grade someone's diet, if someone's going from a D+ to a C+, they're probably going to see a tremendous benefit. It will eventually level out, but it may take a while. But if someone's eating a B- diet and are miserable, they may actually have to make quite a bit of changes in order to start to feel better. And we all have our unique things. Somebody might be sensitive to a particular food and not know it. And until they cut it out completely for months, they may not notice. Things like gluten obviously can cause a lot of problems in people, but sometimes it doesn't. And it is a problem, and they don't know it because they don't have a lot of the similar or common symptoms that you might see. So, but I would say, to answer your question from a dietitian standpoint, I have seen people reverse some pretty incredible clinical issues in about 2 to 4 weeks. And that's going from significantly challenged and miserable to, pretty good in 2 to 4 weeks with meaningful diet change. Not necessarily 100%, but meaningful.
That makes sense. So we're talking with Heather and Dr. Lisette from Bloom Culinary Medicine. And what are some culinary tips and tricks? You kind of touched on it a little bit, Doctor, but what are some of those tips and tricks you can share with us today?
I'm going to hand that over to Heather because she's the expert on tips and tricks.
Well, I think, I think Dr. Lisette's not giving herself enough credit because we do talk about this a lot. But people do cook differently. I'm not always batch cooking every week, but I would say that any amount of planning that you can do ahead of time is going to save you throughout the week. And so when I batch cook, meaning when I cook a lot of food up front, and it may not be a meal, like an actual meal. It may be like, I'm going to make 3 cups of rice and I'm going to open up a can of beans, drain them, rinse them, and put them in a container in the fridge. And I'm going to pre-chop my vegetables and put them in a container in the fridge. A lot of people argue that cooking healthy food takes a long time. And I would argue that it's not the cooking that takes a long time, it's the prep, because you're actually doing it yourself. And you can lump those behaviors together all at once, and you'd be amazed what you can get done in just 1 to 2 hours, and then save yourself 20 minutes every single day throughout the week. And what normally would be like a 40-minute ordeal is now 15 to 20 minutes, which most people are willing to do on a daily basis. But it does take a little bit of time, 1, maybe 2 hours, depending on how many people you're prepping for, up front. And so that would be one major thing that I would recommend people consider doing.
Yeah, I think that's a really, really good tip. So, all right. Well, as we wrap up this segment, how do you guys see the rest of your year taking shape?
Yeah, do you want to take that, Lisette? So
we plan to have our free webinar. We're working on that right now on developing our free resources that we're going to be giving our attendees. And then after that, we're going to have like a Q&A session, of course, during that. And we're going to try and get a lot of information from the people that attend. And then we're going to build out our first course. And we're planning to offer that. And we, of course, making lots of announcements on that and have like the meal plans and things for people. We'll have like I said, free webinar, and then we'll have like different levels based on what people's interests are, like how much of a detailed meal plan, for instance, do they want, 7-day, 14-day, how much information are they looking to get? And our goal is to really zone in on this low iodine diet and really figure out, how to kind of get that ball rolling and really get that set up for people with a bunch of resources on our website that we still plan on putting up, and trying to make life easier for people that need to undergo this diet. Eventually in the future, we plan, of course, on addressing other medical conditions and dietary restrictions. But right now we're placing our focus on this low iodine diet for now.
It sounds amazing. Well, when we come back, we are going to wrap up with Heather Borders and Dr. Lisette Bickford from Bloom Culinary Medicine. We're going to leave with top 3 takeaways. There's plenty more we could definitely touch on, but stick around and we'll give a little more details on how you can contact these ladies as well. The conversation will continue. Millennium Physician Group Radio will return right after this. Welcome back to Millennium Physician Group Radio. I'm Michelle McCormick. Our conversation today has been extremely informative about culinary medicine and how food has a direct impact on our health and well-being. We've also talked a lot about low iodine diets in relation to thyroid cancer. Our guests today, Heather Borders, a registered dietitian and licensed dietitian nutritionist, and Dr. Lisette Bickford, a doctor from Rice University that have developed this Bloom Culinary Medicine website with so much information. So ladies, thank you guys for your conversation today. Heather, I know you've been working on this. What should our listeners take away from our conversation today?
Yeah. So the next steps is for everyone to go to bloomculinary.com, and there's 2 free resources. Well, there's quite a few resources out there. The 2 downloadables are going to be our quarterly Bloom Culinary Medicine, Give a Hoot e-magazine, loaded with tips and tricks, loaded with recipes, information on food, what's in season so that you can, stay within your budget. The other downloadable is specific to our upcoming course, and that is the Low Iodine Diet Survival Guide. Again, both are free. You just go in there and tell us what email to send it to. The other thing, too, is check out our blogs because in addition to generic culinary medicine blogs touching on how to prepare certain foods and tips and tricks related to making a new lifestyle change easy. We also have, we'll be dropping blogs every Sunday related to the low iodine diet and thyroid cancer. So we just started doing that a few weeks ago. So there's a few on there, and then we'll be dropping one a week for the rest of the year. If you're interested in staying up to date as to when the most immediate free webinar is going to be, you can do that on our website as well. Either of those downloadables will allow you to be updated. We're really excited about this webinar. In addition to just all the information about thyroid cancer and radioactive iodine treatment and low iodine diet, we're going to do a cooking demo. We're going to show people how to prepare for it. And those that sign up will be able to have a discount on the course that comes out later. And we also will have special opportunities for people to do cook-alongs. So me and Lisette will be in our kitchen, and we will be cooking along with others that are interested in learning how to do this.
Yeah, you got to love the power of Zoom and and cooking demos. I find that fascinating. So when is the seminar scheduled for?
We don't have a scheduled date yet. But if you just go to the website and download one of those subscriptions for the ebooks, you will definitely be notified. We would say probably no later than September. So it's coming up.
Okay.
It's coming up.
And if listeners want to contact you guys directly, is there links on your website for that as well?
Yes, ma'am. That, and they can follow along on Instagram. It's just all Bloom Culinary Medicine, and Facebook, Bloom Culinary Medicine as well.
All right. So, Doctor, thank you for joining us from the West Coast today, the West Coast of the country, rather, not Florida. But we really appreciate your information and how the lifestyle change, if you were able to do it with your entire family. I'm sure everybody feels very, very good and healthy these days as well.
Thank you so much for having me.
Yeah, and Heather, always a pleasure. Thank you. It was great to catch up with you about nutrition and learn a lot about Bloom Culinary Medicine. I think this is going to really be successful for you ladies.
Thank you so much again, Michelle. It's always good to see you, and thank you for having us.
Yeah, absolutely.
Thank you.
The conversation will continue next time on Millennium Physician Group Radio. Your healthcare journey, very important to us, and our goal at Millennium Physician Group is to work together to achieve the best health outcome for you. That always starts with seeing your primary care provider, so make that call. See our website for a full list of offices and providers at millenniumphysician.com. In good health, I'm Michelle McCormick. So long for now.